Welcome to this explainer. Today, we're going straight behind the curtain of the medical world to explore the hidden, rigorous, and honestly awe-inspiring training journey of internal medicine professionals. If you've ever wondered exactly how a medical student transforms into the person who literally saves lives, you are absolutely in the right place. So, I want to hook you right away with this question. What does it actually take to become a medical detective? I want you to completely rethink your everyday clinic doctor. They aren't just sitting there writing prescriptions. They're highly trained medical detectives who've spent years learning to solve the most complex, unpredictable bodily mysteries. But how exactly do they build that superpower? How are they trained to look at a vague cluster of symptoms and pinpoint the exact failing organ? Well, the answer is right here. This is the official O2-113 internal medicine document. It's the highly technical Ministry of Health and Welfare training guideline detailing the exact specialist training these doctors absolutely must complete. Now, at first glance, it might just look like a dense, bureaucratic piece of government paperwork filled with tables and rules, but in this explainer, we're going to demystify it. We're going to decode these dense tables and translate them into the thrilling, high-stakes story of how a master physician is actually forged. Here is our roadmap for today. First, we'll look at the overall internal medicine journey. Then, we'll break it down year by year. Year 1 is core foundations. Year 2 shifts to advanced skills. And Year 3 dives into critical care. Finally, we'll wrap things up with something incredibly important, beyond science, focusing on holistic care. All right, part 1, the internal medicine journey, charting the path. You know, before a doctor can specialize in something highly specific, like just the heart or just the brain, they first have to conquer the entire internal landscape of the human body. This timeline represents a thrilling evolution. In Year 1, they're building their foundational knowledge. By Year 2, they're executing advanced physical procedures. And by Year 3, they're achieving critical care independence. It's literally a leveling up process from novice to absolute master. But exactly how long does this all take? Well, depending on a doctor's prior general medical training, which is often referred to as their postgraduate year or PGY track, this grueling path takes between 2 to 3 full years to complete. The standard track is a full 36 months of intense, unbroken internal medicine focus. Those coming from specialized internal medicine postgraduate groups might finish in 2.5 or even fast-track it in 2 years. But make no mistake, the massive volume of knowledge they must consume remains exactly the same. Moving into Section 2, Year 1, Core Foundations. Absorbing the medical encyclopedia. Okay, let's dive into this. This is the phase where these young doctors must basically absorb an overwhelming amount of information to build an unshakable base of diagnostic knowledge. Just think about the sheer breadth of body systems and diseases a first-year resident has to master. The training manual mandates exposure to cardiology for the heart, pulmonology for the lungs, nephrology for the kidneys, plus gastroenterology, endocrinology, hematology, and oncology for blood and cancer. Then you add in rheumatology, infectious diseases, and even neurology and psychiatry. They're required to care for up to 15 patients at a time, seeing pretty much every conceivable failure of the human body. So how does the medical board actually ensure these doctors know what they're doing? They use what the guidelines call a learning passport. Their progress is meticulously tracked via this official logbook, because you see, becoming a doctor isn't just about passing multiple choice written tests in a quiet room. It's about constantly verified real-world skills. Every single diagnosis, every physical exam, and even their medical attitude has to be directly observed and physically signed off by senior attending physicians. Which brings us to Section 3, Year 2, Advanced Skills. Becoming the Master Mechanic. Once that foundational passport is filled out, the whole analogy shifts. They're no longer just medical students, they become master mechanics. Let's compare these two stages to really grasp the massive leap in complexity and risk here. In Year 1, a resident is mastering interpretation. They're reading basic ECGs to check heart rhythms, interpreting chest x-rays, drawing arterial blood. But by Year 2, they're explicitly required by the training guidelines to perform high-stakes, invasive procedures. They're placing central venous catheters deep into major veins. They're inserting Swan-Ganz monitors directly into the heart to measure pressure. They're actually performing liver biopsies. The stakes go from reading a map to actually navigating the minefield. And speaking of minefields, here is a profoundly important number mandated by the training manual: 2. This represents the absolute minimum number of months a second-year resident must spend strictly in the intensive care unit, totally surrounded by patients in critical condition. Add to that a mandatory month in the emergency room. We're talking about an environment of intense, relentless pressure, where split-second decisions literally mean the difference between life and death. All right, on to Section 4, Year 3, Critical care, mastering the unpredictable. This is the climax of their training. They've learned the systems, they've mastered the physical tools, and now they have to handle the absolute most critical life and death scenarios entirely independently. According to the curriculum, a third-year resident steps into a role of profound responsibility. Step 1, they're managing acute systemic failures. That's when a patient's heart, kidneys, and lungs are all failing simultaneously. Step 2, they oversee incredibly complex interventions. We're talking about managing hemodialysis machines and handling those delicate, highly dangerous periods following bone marrow transplants. And Step 3, they have to seamlessly formulate highly complex, integrated treatment plans for patients who don't just have one disease, but maybe 5 overlapping conditions. They truly become the ultimate medical coordinators. Finally, Section 5, Beyond Science, Holistic Care, the human element of healing. Now, what's really interesting about all of this is that all that intense biology and mechanical skill, it's honestly completely useless without the beautiful human element of healing. There is a specific phrase pulled right from the curriculum text that says, hospice, palliative care, and patient autonomy rights. The government explicitly mandates that these doctors must develop profound emotional skills, not just biological ones. They are formally trained on how to manage the end of life with grace, focusing on easing pain and deeply respecting what the patient actually wants for their own body. So mastering the science simply isn't enough to graduate. To get their final certification, these residents have to master the art of empathetic communication. The guidelines specifically highlight the need to expertly communicate with elderly patients and their families. Think about it. A doctor must know how to take a complex, terrifying diagnosis, sit down in a chair, look a scared family in the eye, and explain it clearly and compassionately. It is a massive, heavily weighted part of their medical evaluation. So as we wrap up this explainer, I really want to leave you with this final thought. Next time you sit in a clinic waiting room and that door opens, will you see just a doctor? Or will you see a master detective, a master mechanic, and a compassionate communicator who has survived years of grueling, meticulous training to perfect the incredible craft of keeping you alive? Thank you so much for exploring this fascinating journey with me today. Stay curious, and I'll see you next time.